Welcome back, everyone. How can a compact portable refrigerator increase vaccination rates in a country? That's the question we'll be asking our guest, Norah Magero, a mechanical engineer from Kenya. Norah is a pioneer in her field, solving problems at the intersection of health and sustainability. She's the co-founder of Drop Access, an organization dedicated to partnering with rural communities to devise sustainable solutions to pressing challenges. Amid the onset of the COVID-19 pandemic, Norah developed a powerful solution, a portable, affordable fridge powered by solar energy that can be easily mounted on a motorbike. Currently, an estimated 1 billion people, approximately 12% of the world's population, live without reliable access to electricity. This significantly impairs healthcare systems' capacity to sustain crucial services like cold storage for vaccines. It's for this reason that this type of portable technology has the potential to be game-changing. Norah, it is such a pleasure to have you with us today.
Thank you so much for this invitation, and I'm glad to be featured here today.
I'd like to dive right in by asking you about the story of VacciBox. What gave you the idea to really invent such a needed technology for rural communities?
So essentially, VacciBox is a brainchild of several occurrences in my life as an engineer, as a mother, and also somebody who lived in a rural community. So I have worked extensively with the rural populations. I've worked with farmers. I've worked in populations and communities that do not have electricity. But I think the biggest initiation to why VacciBox needed to be created was when I became a mother while living in a rural community in Eastern Kenya. And there were some instances where I could not actually access vaccines for my own child. I would go to the clinic and I'll be turned away because there's a blackout and there to discuss the vaccines, or they just no longer stock them since the power is unreliable. So I always toyed with the idea of there needs to be a solution that will ensure that mothers like myself or anybody has access to these life-saving vaccines. But then with the onset of COVID, it was very, very, very clear that VacciBox needed to come to life. When COVID started, I was actively building a cold chain solutions for farmers to take their milk to the market to store them. And it became very apparent that at the end of the day with COVID, these farmers might not be alive to actually take the milk to the market. So we had to do a pivot to switch our portable solution to be used for healthcare. And given the experience I'd had as a mother who could not access vaccines for a child, and now COVID here, and yet I was building a portable refrigeration, VacciBox had to be born. And it being portable just had to address the various gaps in the community I lived in. I mean, you live a tarmac road and go through a forested area or go over a river, over a river using a boat, or even just places where there are no roads to access healthcare or even to deliver healthcare, just inspired the portability of VacciBox, and then it being able to be mounted on the various forms of mobility, the bicycles, the motorbikes, the boats, the camel, the donkeys that are used in the communities that I lived in.
Tell us how VacciBox works. So I have my vaccine. I want to keep it cold for the next 12 hours while I cross rivers and fields. How does it work? What happens to my vaccine once I put it in VacciBox?
Well, even before I go into that, the beauty of VacciBox is that it's going to give you more than 12 hours. So you don't have to worry or rush against time. So if you need 16 more hours, it will give you. So VacciBox is a solar fridge that comes embedded with the battery backup that goes for between 24 and 36 hours, depending on the usage. And it's a 50-liter fridge capacity that is 31 kgs in weight. So essentially the fridge is plugged to a solar panel and the battery is charged to provide that power to run the compression and the cooling capacity of the fridge. The way it's built, it's been made to suit for medical items like vaccines, like the ones that need to be transported, the blood for transfusion, and they're placed inside the fridge, and the fridge is actually being mounted on a motorbike or a bicycle and switched on. It's going to remain in operation while in portability through that entire period. So if you take it to maybe a market to conduct vaccinations, you can always retrieve the vaccines and just close the lid of the fridge and you'll be guaranteed that the vaccines inside the fridge will still be maintained at positive 2 degrees Celsius and positive 8 degrees Celsius. And even the time when they're being retrieved from the fridge, they're still at that temperature. Another amazing thing about VacciBox is that it's a smart fridge. It's IoT enabled with the Internet of Things. So as it is in motion, going to a far off market on a motorbike, as a manufacturer and also as a nurse, there's traceability. It can be traced where it went through, which route it went through, what temperature it was at any one point through the transportation, and the temperature the vaccines are stored when they're being issued. And any day you want to find out what temperature the vaccines were issued at and what location, you can actually just get it from the platform. And this data is being used to build better service deliveries and programs for rural communities where there's no internet, where there's no electricity, where there are no roads, to just ensure that any child in those communities or any person in those communities actually do get a vaccine that is equally still viable and it's still it's potent. Yeah.
And I would love to learn more about the process that you used to design VacciBox. For example, did you consult local healthcare professionals? Did you work with local nurses? And then moving on to the rollout stage, how did you involve communities in understanding how to perfect the rollout process?
Sure, definitely. So before even VacciBox could be designed, and the first design involved literally drawing it on a piece of paper in a notebook, I conducted interviews with the nurses in rural and far-off communities, and these nurses are based in these local hospitals, really low-level hospitals, the level 3 and below hospitals like the dispensaries, the delivery centers, and these nurses are tasked with getting vaccines from higher level and repository of these vaccines to now to these local hospitals. So they walked us through the journey of how they get the vaccines there, and they walked us through the challenges, which enable us to just get a preliminary drawing of VacciBox. Then we go to the point where now we started toying around with how do we locally manufacture it? What material is it gonna be? How is it gonna operate? The temperatures that the communities need, and also just the ambient temperature where we were testing it. Eventually, when we got the first prototype, we went back to the nurses in these healthcare communities who told us what they needed and showed them, look, this is what we have for you. So it took a few days of testing if it's cooling through these nurses. Then they give us feedback like, oh my God, it's actually cooling between positive 2 and positive 8 degrees. But I would love to have this feature and that feature. And these tests using these nurses in these local communities just helped us to upgrade various versions of VacciBox.
I think that real world feedback is just so important, and it can really make the difference between a life-changing innovation and one that kind of just sits on the bench. And speaking of life-changing innovations, I'd love to switch speeds a bit now and ask you about how you incorporated intellectual property into the journey of VacciBox. How have you used IP?
So IP has really come through for us. First of all, getting the local patent for VacciBox and walking through the legal processes and the expertise to just lead us to knowing what aspects of the fridge were novel and which weren't. Also just making us realize also ways of how we can build the value proposition better. But getting the local petty patent for us and also the trademarks and also now applying for the international patent has really helped us also to build the use case to investors and tell them, hey, we have a product that is not being done somewhere else in the world, and we think that you should invest in us. And luckily, some have actually come in on board to actually finance VacciBox, give technical support for VacciBox, just because we're able to demonstrate that the novel features of this product that are just not applicable in Kenya, but the entire global South. Another thing about patent is it's actually brought VacciBox to reality. So when we started VacciBox, and even personally for myself, it was to help a community. We hadn't really seen the bigger vision of how far and wide it can actually be used. And going through the IP process, we realized, oh my God, this is not being done in various countries. It means there is opportunity here to create impact, but also to build a viable business case. So getting the IPs and working through the IP process has also just given us a bigger vision of how we can build VacciBox, not just for my rural community in Eastern Kenya, but literally each and every single person in the global South and anywhere where there is no electricity or technology to access VacciBox. And slowly partners, investors are believing in us, but just seeing that there are various countries and regions that truly do need VacciBox, and the IP process is actually proving that.
So my last question to you is, what's next? What's next for you? What's next for your company? What's next for VacciBox?
Well, for VacciBox, we are scaling the use case beyond Kenya, which is really, really exciting and scary for us. We've been able to use VacciBox in Tanzania and in Cote d'Ivoire, and it's also made me realize how bigger the impact is and much more work that needs to be done. So I think for me as a leader, I am changing my perspective about technology development and thinking about building for the whole global South ecosystem, not just the Kenyan ecosystem. So there's just much bigger responsibility on my end. And to me, it means going back to school maybe, or going back to capacity development so that I am ready, not just to run this work in Kenya, but the whole of the global South and literally from anywhere. So I'm changing as a leader for this organization. My attitude, my perspective is changing, but then also the company is growing in preparation for what's about to come. The many more partners who are coming in to support us, and also we are realizing just the potential of what we've built here. So we need to prepare for that, the future of VacciBox. That means the VacciBox being operated, being used literally in any place of the global South. It's a huge thing that has to start, I think, mentally for us before it trickles now down to the structure that we have to put into place. So we are fundraising, we are recruiting and looking for talent each and every single day. We're thinking of various business models, but also we're looking at impact differently, because the way impact is achieved here in Kenya is going to be different. How impact will be achieved in Uganda, and how it's going to be different with the impact that we'll achieve in Indonesia. So I think also for us, we're looking at impact differently, also just given the various milestones that different countries have achieved. And I am ready, and I feel like we're ready.
I believe you when you say it, Norah. I think you're ready too. And I love your point around the importance of south-to-south rollout. The fact that something that was created in Kenya can now be rolled out in neighboring countries and other southern settings, I think is incredibly important.
It's true. I personally, I am a firm believer and a push for South-South collaboration, mostly because there was a point, there was an Indian-based company that really wanted VacciBox to be used in India. And the biggest barrier was a bit of international certification that VacciBox still doesn't have, and now we are pursuing for. And it got me thinking that the same challenges that we have for cold chain in Kenya are not different than the ones that are happening in India. So we need to be talking to each other. We need to share experiences. We need to share technologies. We need to share knowledge just to ensure that we're tackling this problem. At the end of the day, it will be 1 billion people globally.
Norah, thank you so much for your wisdom, for your experience, for your innovative spirit. It was a pleasure to spend a few moments with you this afternoon.
Oh my God, thank you so much for hosting me, really. Thank you.
And thanks to all of you for joining us for this discussion. I hope you've gained valuable insights into the power of ingenuity and technology to help get vaccines to the last mile. Don't forget to stay tuned for more engaging conversations by subscribing to the WIPO channel for inspiring videos that showcase how innovation and creativity shape our world and our lives. Until next time, stay well.